Welcome to Prep and Play, where we have conversations about safer sexual pleasure. This podcast is dedicated to empowering listeners through open, honest discussions surrounding keeping our minds, bodies, and spirits healthy while being sexually active. My name is Danielle, and I'm the Rural Outreach Specialist at AIDS Alabama South, and today I have with me...
My name is Rachel Carter, and I'm the Nurse Practitioner and Director of Clinic Services at Shell Health Clinic.
And today we will be continuing our Birth Control 101 series with hormonal birth control. So there are several different types of hormonal birth control. We're going to talk a little bit about their efficacy, their ease of use, and some possible side effects so that you can determine, what might be the right fit for you. So first up, Rachel, we have hormonal IUDs. What's an IUD?
So an IUD is an intrauterine device. So this is something that has to be placed by your healthcare provider. They are very popular. They are extremely effective because they are placed, fitted. They have the hormones, all of that. They work really well. It's kind of like you don't have to think about it because it's already there, which is probably why they're so effective. But they're very small T-shaped devices that are placed up into the cervix and into the uterus.
Awesome. And you mentioned they're very effective. How effective would you say they are?
99%.
We love that.
Yes.
We love that. And then other than having a healthcare provider insert it, it's pretty easy to use because once it's there, you can just forget about it.
Yeah, it's kind of like fail-proof because it's already there.
We love zero user error. What are some possible side effects that somebody might encounter with a hormonal IUD?
So it is kind of tricky just because depending on how your body responds to these hormones, you may or may not have some irregular bleeding, spotting. Some people have no bleeding at all. That's kind of why they are very popular. But on the offhand, others will have heavier bleeding. So it depends on the person.
Awesome. That makes a lot of sense. Okay, so next up, another type, we have an implant. I think it's worth mentioning that I've tried almost all of these.
So let me see.
Yeah. Okay, so we have 1, 2, 3, 4, 5, 6 types, and the only one I haven't tried is the NuvaRing.
Same.
So do you want to tell us about an implant? What's that? What does it do?
So an implant is similar to an IUD. It's just placed in a different spot of the body. So the most common area for this, it's a very small rod-shaped device, is going to be the upper arm. Again, this one is 99% effective as well. Works extremely well. Is also placed by a healthcare provider.
Those are also about the same efficacy, correct? 99%.
Yeah, and I believe majority of the time the side effects can be similar. The only difference is being that with the IUD, the irregular bleeding, heavier bleeding because of where that device is placed. In terms of the like the Implanon or the Nexplanon being up in the arm, there's not as much of the cramping and irregular spotting. But again, it is another possible side effect.
That makes sense. And those can be effective for up to 3. I think I've heard there's like a 4-year one, so like 3 or 4 years.
I thought it was 3 to 5, but I think
years.
like 3 is kind of the safest route.
The IUD is effective for 3 to 7 years.
Yeah, actually, the Mirena can go up to 10.
Up to 10 years. Wow, that's okay.
Kind of crazy.
Yeah, I actually currently have Nexplanon, and I love it because I know it's there. Like, I can feel it in my arm. Because, like, as far as an IUD, I was concerned with that because it has the little strings that you're supposed to be able to feel. And at one point, I remember trying to feel them, and, like, I couldn't feel them, so I freaked out about it. Also, it really hurt when they put it in and took it out. I didn't like that.
Yeah, so an IUD, depending on which one you get, I mean, it is going to be slightly painful, but if you have not actually had children and had your cervix open up, it is a pretty extreme discomfort for a little bit.
Oh, so it would be less painful after having kids?
Supposedly.
Yes. Yeah, but with Nexplanon, they numbed my arm. I didn't feel anything. It was like a mild bruise the next day, and then it was fine. The only issue I've had with that is it was placed close to my bicep, and then I started working out, and I gained a lot of muscle, and it was like uncomfortable for a while, so they had to move it back to the back of my arm. And then we have the shot, the Depo-Vera shot. So what does that entail?
So this is just a shot that you would get, I believe it's every few months, unless they've changed it, but that's what it used to be. It's easy. You can get it ordered by your provider to the pharmacy, and you can inject it on your own. You can have a loved one inject it, or you can also go in and have your healthcare provider inject it when it's time for it. So again, it's pretty fail-proof. It's not something that you have to take every single day. It's nice.
So it's also that 99% effective. What are some possible side effects somebody could expect with Depo-Vera?
I think the one that people complain most about with the Depo-Vera is going to be weight changes for females. And it's just because it is a pretty large dose of hormone, which can cause, it's not necessarily you to gain weight, but it is convincing the body that you are pregnant, which is how it works, so that you don't get pregnant. And so you can notice like some weight around the hips that are changing, your breasts can enlarge, things like that because of the hormones.
Yeah, I did gain a decent bit of weight when I tried Depo-Vera. But actually the reason I discontinued this one wasn't the weight gain, because it actually was going to some pretty nice places.
Yeah.
It was fine. But I discontinued Depo-Vera because I think my physician informed me that it's about 9 months after your last shot that you would expect to be fertile again. And so like this is one that has a very long delay in fertility after use. But in my head, I might get married and decide to have kids within a 6-month period. So that was absolutely unacceptable. Yeah. So next up, we have the patch. Can you explain the patch to me?
Okay, so the patch I would say is probably, in my opinion, one of my least favorite, just because I feel like if you don't place it in the right spot, if you're somebody that likes to work out a lot or have a lot of friction to that area, I just don't see how effective it may be for various reasons. It is noted to be 91% effective with typical use, but again, that's going to be like at best use. So if it's 91 at best use, how is that, like that's something just to think about. It's convenient. You place it and you change it weekly, and then you have 1 week where you don't wear the patch. But again, it's kind of like a Band-Aid. So I did try it, and if you wear it, you notice like after a couple of days, you get like that little film built up around it. It just looks gross, and then you take it off and you still have that mark. But all of those are a lot better than getting pregnant. So it's like you can pick and choose what is best for you.
Do you want adhesive marks or stretch marks, ladies?
Right.
I guess first, what are some side effects?
Side effects for this are going to be pretty similar to taking a birth control pill. So some mood changes, maybe some slight weight gain, irregular bleeding at times, headaches sometimes.
So the one I haven't tried, the NuvaRing, can you explain how that works?
Okay, so the NuvaRing is going to be something, the same schedule as the patch, but this one is inserted up into the vagina to release the hormones. It says that it is 91% effective with typical use, so this is one that you have to be careful with movement of it during different activities, or if you are changing, like if you've lost a lot of weight, gained a lot of weight, anything that could possibly change the way that it fits up into your vagina, you're going to want to make sure that you're being consistent with getting it changed out on a regular basis. But it's a weekly thing. Take it out for the week of your cycle, and then it's placed back in.
And what could be some possible side effects with the NuvaRing?
I think nausea and headaches is one of them, but I'm sure like mood changes, anything hormonal for a female is going to be something that you can think might happen.
And while I have not used the NuvaRing, I do have a coworker who that's her preferred form of birth control. And I will just say she just had her second child that she conceived while on the NuvaRing. So,
well, there you go.
91% effective, quote unquote. And then last but certainly not least, we have probably the most common, which is the pill. Can you tell me a little bit about that?
Yes, so birth control pill, this is going to be like one of the oldest, most common forms. It is a daily pill that you take. You can either take a combination of these pills every single day to where a female can skip their menstrual cycle, or you can take it for 3 weeks and then be off of that pill for your menstrual cycle. This is probably the most popular just because it helps you realize, like, a lot of people know when their cycle's coming. It's another way for them to know if there's a possibility of being pregnant. So just having that regular cycle is good. Birth control pills are also really good at helping if somebody has hormonal acne issues, if they do have really heavy periods. This can help with that too.
And it's important to note that this does require daily administration. Like, this is the only thing you have to worry about every single day is the oral contraception. And that consistency is crucial for effectiveness. And they mean taking that at the same time every single day. And you mentioned that most of these hormonal methods have like nausea, weight gain, mood changes as side effects. I personally didn't experience many side effects on the pill, but I could not take it every day. Like, I would have alarms set and then I would just be nowhere near wherever I had my pill. And I just didn't trust myself to be consistent enough with taking it.
Yeah.
I guess let's talk a little bit about like how somebody can choose the right option. So some factors to consider would be lifestyle and convenience. If you can't remember to take vitamins every day, you might not remember to take your pill every day.
Yeah.
If you sweat a lot, the patch might not be for you. If you want to get pregnant immediately, Depo-Vera, probably not for you. If you've never been pregnant, the hormonal IUD will be more painful, apparently.
There is smaller options. Like, Mirena is probably the most common, but they do have the Kyla, which is supposed to be like the smaller version of the Mirena. And I think that might be a little bit better for individuals that want the IUD, but...
So it's important to look at like which method might fit a person's daily routine and their preferences in general. I like to have a set it and forget it type of thing.
Yes.
I don't need a regular period so much as I need to know that something is super effective, and as long as I don't mess it up, it'll be there.
Yes. And then something else to remember is if you are, depending on your lifestyle, if you do smoke on a regular basis, if you have any type of family history of blood clots or anything cardiovascular wise, you also want to keep that in mind when you're picking, because hormonal birth control pills, especially those that contain estrogen and progesterone, are going to put you at a little bit of a higher risk for developing blood clots as well.
Oh, okay. Are there any other medical considerations somebody might need to worry about?
That's probably the biggest one.
And then long-term goals, whether you prefer a short-term or a long-term method, like I was just saying,
Yes.
if you want to get pregnant. And then consulting with your healthcare providers is super important with this, because the gynecologist I have now is super, she actually talks to me. Like, I feel like I've never had a gynecologist ask me questions or anything like that before my current one. And she like tries to figure out what's best for me and like takes my input and stuff like that.
And that's how it should be, because there's like a million different options. So you should be able to sit down and figure out what is best for you. Not just because that's like most common or easiest to get or whatever, like what is best for you.
Exactly. Let's just address a couple common questions and concerns here. So as far as effectiveness, why are some methods more effective than others?
It's the ease of use and remembering to use it, and just fail proof. Like the IUD, being that it is medically inserted, that is kind of like a fail proof method, as well as the implant being there all the time. Like, it's not something that you have to remember. It's not generally something that's going to move and be out of place. So it's pretty easy. Whereas some of the others, like if you forget to take it, if you forget to change your patch or put it in the right spot, or maybe you're wearing too much lotion and it's not absorbing appropriately, those are all things that you have to consider. They're not going to work as well if they're not placed in the right spot or taken at the right time.
That makes a lot of sense. And how might somebody manage the side effects? And like, when should somebody consult a healthcare provider about side effects?
If you're having side effects to where it is bothering you and you're not able to do like your regular daily things, that's definitely a time that you need to talk to your healthcare provider. Or if it's a side effect to where you're not wanting to use it anymore, or you're not taking it regularly the way that you're supposed to, that is not going to be a method that works for you. So you would need to talk to your healthcare provider also. Oh, and then something that we forgot, If you are sick and you have to take an antibiotic while taking the oral birth control pill, you need to use a second method because a lot of antibiotics will completely throw off the birth control pill from working.
Oh, wow. Also, a note on that, I've heard that GLP-1 medications that slow down digestion can also affect efficacy of not just birth control, but any type of oral medication, but specifically oral contraceptives. And then, yeah, so I know I talked a bit about Depo taking a while to return to fertility after using that, after discontinuing that. How soon could somebody expect to be fertile after discontinuing these other methods?
So a lot of times you're fertile right after, but the issue is to make sure that your body is back to baseline hormone level for both you and the baby to be as healthy as possible. So it's recommended anytime you stop taking birth control to wait 3 months, at least.
Okay, that makes perfect sense. All right, so just to recap, we talked a little bit about, 6 different types of birth control: hormonal IUDs, implants, the shot, the patch, the ring, and then birth control pills. We talked about how effective they are and how the ones without user error are the most effective. And we talked about ease of use and potential side effects with all those. So I would like to emphasize the importance of finding the right method through consultation with your healthcare provider, because if something doesn't fit your lifestyle, you're not going to do it, and you're going to end up pregnant.
Yes.
You will get pregnant and die.
Yes, you will get pregnant and you will die.
Do you have anything to add there?
Just be open and honest. If you are seeing a healthcare provider to where you feel like you can't be open and honest with them, then they are not the appropriate healthcare provider for you. So definitely be picky, find somebody that you can talk to, because if we don't know everything that you're taking or your lifestyle and how, everything works for you day in and day out, we can't help you make the best decision for you. So it is very important.
That is a great point. Well, thank you so much for joining me, Rachel.
Thank you.
Thank you, everyone, for listening. And then on our next episode, I'm so excited about this one, y'all. On our next episode, we will be discussing anal health and pleasure with Dr. Brian Kuttner. Thank you.